when we are talking about the inflammations, right? So what is inflammations? Inflammations is a condition or immune response from our body which aim to get rid of the invader that coming in. The invader, for example, it could be infections like bacteria, fungus, or virus. The commonest one nowadays is the COVID-19 adenovirus, which is bugging everyone now. On and off, we're still doing the RTK test. Secondly, it could be from the example like toxin, heavy metal, chemical or hydrocarbon. And thirdly, it could be because of injury, for example, accident or cuts, or when we fall down and then we might have lacerated skin surface area. So those are considered as inflammations, and we divide it into two, which is acute inflammations and chronic inflammations. So what is acute inflammation? Acute inflammations is inflammations which last within hours to a few days. So usually, if our body is healthy, for acute inflammations, it will heal within a very short period of time. However, if the patient's having issue in healing, for example, malnourished or hormone deficiency, sometimes simple injury or simple wound, it might extend up to the level causing a prolonged inflammations. That is chronic inflammations. The main differentiating factor for acute and chronic is the durations. Acute inflammations usually is not that harmful. Usually with the naked eye, we know that, it's healed already. For example, running nose, cough and cold. So usually it will be able to resolve within a week. However, if the cough and cold eventually linger and then last more than 2 or 3 months, that means that in the respiratory tract, there is certain degree of inflammation which is going on, which our body not able to get rid of. After we talk about what is chronic inflammations, then what are the common signs of chronic inflammations? For example, if the inflammations happens on our skin, basically you will be able to see some rashes, itchiness, and then sometimes, like for example, acne. Secondly, if the inflammations happen in our lung, then for example, cough and cold, running nose, if it's happened within short periods, then we call it the acute inflammations. However, if it lasts longer than what it's supposed to be, then it might turn into chronic inflammations. Besides that, frequent headache and migraine is also a type of chronic inflammations. So general inflammatory conditions, for example, water retentions, and then feeling fatigue, tired, sometimes we even call it as the chronic fatigue syndrome, is also a sign of chronic inflammations. If inflammations happen in our gastrointestinal tract, stomach upset, gassy, diarrhea, stomach pain, or commonly in elderly patients, when they are in the lying positions, they will complain that there is a burning sensations at the upper part of the abdomen. We call it the esophageal reflux. It's also a type of chronic inflammations. Not to forget as well, other signs of chronic inflammations like lower back pain, joint pain, knee joint swelling, those also are chronic inflammations. Whenever we talk about the common symptom, it's actually organ related. So organ related, they are invader from external environment which is invading into the body. For example, for the lung, commonest invader basically will be infections agent, bacteria, viruses. The second commonest invader, which is the environmental toxin. For example, cigarette smoke, cadmium, nickel, aluminium. And then for the gastrointestinal tract, what do we have is actually things that which we encounter commonly, generally will be the type of food selections that we have. So for example, in the gastrointestinal tract, it will be a little bit more complicated because not all food is suitable to individual persons. So for example, certain superfood might not be a good choice for certain group of patients if they have chronic inflammations. And then if the patients have leaky gut conditions, then most of the food will be triggered. However, if we are able to improve the overall health conditions of the patients, for example, if we assess the patient's vitamin D level, if we are able to restore back the oxidative stress of the patient's body, they might be able to compensate better when the invaders sets in or the allergens come in.